Today we will know what is diabetic nephropathy. Diabetic nephropathy is a long-standing complications of diabetes which is seen both in type 1 and type 2 diabetes. It is characterized by damage to the small blood vessels of the kidneys called glomerulus. This leads to inability of the kidneys to filter the waste products and excess of water from the body. Second, it is associated with proteinuria. So initial stage of diabetic nephropathy, we see microalbuminuria, that is small amount of protein is lost. As the kidney progresses and as the kidney disease progresses, patient will have macroalbuminuria. Third, the patient will have damage to the kidneys, leading to accumulation of waste products such as blood urea, creatinine and potassium. Last, it is associated with other complications of long-standing diabetes such as diabetic retinopathy and cardiovascular disease. And most of the diabetic nephropathy is associated with risk factors such as family history, long-standing diabetes, uncontrolled blood pressure, and smoking. So early detection of diabetic nephropathy is very important so that we catch them early and prevent the progression of diabetic nephropathy or slow down the progression of diabetic nephropathy. Thank you. So how to manage the complications of diabetic nephropathy or diabetic kidney disease? How to manage diabetic nephropathy? So the management of diabetic nephropathy is multifaceted directional. So the first important thing is as the diabetes is the culprit for diabetic kidney disease, so we have to target the diabetes itself. So we have to bring down the HbA1c less than 7.5. Many studies have shown lower the HbA1c, it halts the progression of kidney disease, or sometimes prevents the diabetic nephropathy. So first is good glycemic control using medications, diet and exercise. Second is good control of blood pressure. As diabetic nephropathy sets in, there will be a secondary hypertension. We have to optimize the antihypertensive medications and bring down the blood pressure less than 140/80. KDIGO guidelines says lower the better, less than 130/70. Third is we have to decrease the proteinuria. There are drugs such as AC inhibitors, CRBs, which will reduce proteinuria. There are newer drugs such as dapagliflozin, which also decreases proteinuria. Fourth is diet. Diet is an important part of management of diabetic nephropathy. The patient has to take a low salt, low to moderate protein and low saturated fat diet. This puts less pressure on the kidneys and this prevents again progression of diabetic nephropathy. Sixth is quitting smoking. Seventh, not to take any NSAIDs and nephrotoxic drugs. Eighth is regular exercise is very important. So this is about prevention of or halting diabetic nephropathy. The symptoms of diabetic nephropathy like slowly patient can have pedal edema. In that case we have to put on diuretics. patient can have congestive cardiac failure. In that case, again we have to treat as like a congestive cardiac failure way. Patient can have anemia, then we have to treat anemia, we have to correct iron, we have to give erythropoietin. Patient can have acidosis, we have to treat acidosis with sodium bicarbonate. Patient can have hyperkalemia. In this case, we have to put on low potassium diet and potassium binders. So these are a way of treating diabetic nephropathy. Once the patient lands in end-stage renal disease, patient requires renal replacement therapy like renal transplant or hemodialysis. Thank you.
Mangesha! Cinema. Oh, visa. Dubai. Don't be stagnant. Be like a river.
ಬಾಕ್ಸ್ ಮಾಡೋಣ ಅಲ್ಲೋ ಹೋಗ್ತೇನೆ ಇದ್ರ ಮುಂದೆ ಆ ಸ್ಟಾರೇಜ್
ನೋಡ್ಲಾ ಇದು ಫೋಕಸ್ ಆಗ್ತಿದೆಯಾ? ಫೋಕಸ್ ಕ್ಲೀನ್ ಸ್ಟ್ರೈಟ್ ಆಗಿ
Nice to see you. Crack Dinesh. Yes, this way. We have just reached Vietnam and realized that our hotel is fucked.
ಲಾಸ್ಟ್ ಹೋಗಿ